Imagine this. You wake up one morning with a heavy chest, a dry, irritating cough that just won't go away, and a strange pressure every time you breathe deeply, and your first thought is, could this be bronchitis? And more importantly, is it something you might pass on to your family, your coworkers, or your kids at home? That's the exact worry millions of people have every single year, because bronchitis is one of the most common reasons people visit their doctor, and it's not always clear whether it's contagious or not. So let's break this down in a way that makes sense, without confusing medical jargon, so that by the time you finish watching this video, you'll know exactly what bronchitis is, when it can spread, how long you should be cautious, and the steps you can take to recover faster and keep the people around you safe. Bronchitis is essentially inflammation of the bronchial tubes, the airways that carry oxygen into your lungs. And that inflammation is usually triggered by something irritating those airways, whether it's a virus, bacteria, smoke, pollution, or even long-term exposure to chemicals. But here's the thing, not all bronchitis is the same. There are two main types, acute bronchitis and chronic bronchitis, and they behave very differently when it comes to being contagious. Acute bronchitis is the one most people get after a cold or flu, usually caused by the same viruses that are floating around in the air during flu season. And yes, this type can absolutely be contagious. If you're coughing and sneezing with acute bronchitis, you're releasing tiny droplets that can infect others, just like you would with the flu. That's why it often spreads in families, schools, and offices, especially during winter when everyone is indoors. On the other hand, chronic bronchitis, which is a long-term condition usually linked to smoking or long-term lung irritation, is not contagious in the traditional sense. You can't catch chronic bronchitis from someone else, but if they're coughing constantly around you, you might think you can, which adds to the confusion. Now here's where people really start asking questions. How long is acute bronchitis contagious? The truth is, if it's caused by a virus, you can be contagious even before your cough really kicks in, often starting a day or two before symptoms appear and lasting up to a week or sometimes even longer, depending on the virus. Some people may still have a lingering cough for weeks, but that doesn't always mean they're still contagious. It's just their airways staying irritated and taking time to heal. But if your bronchitis was triggered by bacteria, which is much less common, then antibiotics might be prescribed. And once you've been on antibiotics for about 24 to 48 hours, you're usually no longer considered contagious. The big challenge is that most people don't actually know what caused their bronchitis, because symptoms overlap and testing isn't always done. So the safest rule of thumb is to treat it as contagious if it developed after a cold or flu. And take precautions like covering your mouth when coughing, washing your hands frequently, avoiding close contact, and maybe staying home from work or school if you're really hacking up a storm. But let's pause for a moment, because there's another important point. Sometimes people panic and think any kind of cough is bronchitis, or they believe they'll spread chronic bronchitis the same way they would a cold, and that's just not true. Chronic bronchitis is part of a bigger condition called COPD, and it's tied to long-term damage in the lungs. If you live with someone who has chronic bronchitis, you're not going to catch it from them, but if you share the same environment, like smoking indoors, you could develop it over time due to the same exposure. So the contagiousness really depends on whether we're talking about the acute viral version or the long-term chronic version. Now, a lot of people also wonder how they can tell the difference between a simple cough, the flu, pneumonia, and bronchitis because they all share overlapping signs. With bronchitis, the hallmark is that deep, chesty cough that often brings up mucus, sometimes clear, sometimes yellowish or green. And it tends to last longer than a typical cold, often hanging around for 2 to 3 weeks. You might also feel chest tightness, wheezing, and fatigue. If it's acute bronchitis, it usually starts after a viral infection like a cold, so you might have had a sore throat, runny nose, or fever at first. If you're running a high fever, short of breath, or coughing up blood, that's when doctors say it could be something more serious like pneumonia, and you should definitely get checked out. But let's circle back to the big question. How do you protect yourself and others if you do have bronchitis? The number one step is practicing the same hygiene you'd use to avoid spreading the flu. Wash your hands often, cover your mouth when coughing or sneezing, don't share utensils or drinks, and try to limit close contact if you're actively coughing. It's also really important to rest, stay hydrated, and avoid things that make your lungs work harder, like smoking, secondhand smoke, or dusty environments. Some people think antibiotics are a quick fix, but the truth is most bronchitis cases are viral, and antibiotics won't help those at all. Instead, supportive care, like warm fluids, honey for soothing your throat, humidifiers to moisten the air, and sometimes over-the-counter cough medicines can help you feel better as your body heals. For chronic bronchitis, the main way to improve is to stop smoking, avoid lung irritants, and in some cases use prescribed inhalers or therapies to open up the airways. So to put it simply, yes, bronchitis can be contagious if it's acute and caused by a virus, but no, chronic bronchitis is not contagious. The contagious period for acute bronchitis usually overlaps with the early days of your cough when you have the most symptoms, and it tapers off as your body fights off the infection. Understanding this difference can save a lot of worry, especially in families where someone gets sick and everyone else wonders if they're next. And here's something else you should know. Bronchitis is one of those conditions where prevention plays a huge role. By getting your flu shot, practicing good hygiene, and boosting your immune system with healthy sleep, exercise, and nutrition, you reduce your risk of catching the viruses that can trigger acute bronchitis in the first place. For people with weaker immune systems, like the elderly or those with chronic diseases, being around someone with bronchitis can be more dangerous, because what starts as a simple viral infection might lead to pneumonia or worsen existing lung problems. That's why doctors stress not just treating your own symptoms, but also thinking about the people around you. Another myth worth busting is that once your cough sounds wet or produces mucus, it must mean you need antibiotics. That's not true, because the color of your mucus doesn't always tell you whether it's viral or bacterial. Yellow or green mucus can still be from a virus. That's why self-diagnosing can lead to unnecessary antibiotics, which don't help and can even harm by causing resistance. Instead, the real focus should be on monitoring how severe your symptoms are, whether they're improving over time, and whether you're experiencing red flag signs like high fever, chest pain, or difficulty breathing. To wrap it up in the simplest way possible, bronchitis can be contagious, but only the acute, short-term viral type really spreads from person to person. Chronic bronchitis is a long-term lung condition that isn't contagious, but still needs serious attention. The contagious window for acute bronchitis is usually about a week, sometimes longer. And the best thing you can do is rest, protect those around you, and see a doctor if your symptoms seem severe or aren't improving. So next time you or someone you know starts hacking with that deep chest cough, you'll know exactly what's going on and whether or not you need to be cautious about spreading it.